Good afternoon or good morning. My name is Jacinto Ramos Jr. Welcome to MASBA's Black Caucus and Leadership ISD's Responding to COVID-19 Mental Health Issues topic for today. Welcome back after a little bit of time off in between our sessions. We wanted to make sure that we were fully prepared for the hot topics. No doubt a lot has happened in the last couple of weeks with the current state of our country, the topic of race, Black Lives Matter, and we look to being able to return with a topic and subject matter revolving around that. Again, this is a partnership by Leadership ISD, the Mexican American School Board Association, and the Black Caucus to bring you more conversations on these topics around COVID-19 and the impact it's had on school systems. Today, we're going to have a great panel, and it's going to be moderated by our good friend from Houston ISD, Holly Maria Flynn Villaseca. At this time, we will turn it over to her. Thank you, my friend. It's on you.
Much for the introduction, Cinto. We are super excited to be back online in the mix of the discussion to address some of the different ways that leaders across the state of Texas and education are addressing COVID-19. And so today we're happy to have three panelists join us today to talk a little bit about mental health policies and social emotional needs and how they as leaders are addressing that in their respective districts and supporting districts across the state of Texas. We do know that, so I'm going to go ahead and pass off the mic to the three panelists. We have Dr. Granita Lathan, Superintendent of Houston Independent School District, here with us. We also have Ms. Selena Munoz from Isleta ISD and Mr. Chad Castruita as well. So we're going to go ahead and offer the opportunity for each one to introduce themselves. And we want to thank you so much for your time today to share with other policymakers, administrators, board members here close to Texas and across the United States about what you're doing to help support our students and families on the front lines during the pandemic as far as their emotional needs are concerned. So thank you so much. Welcome. All right, we're going to go ahead and start off with Dr. Lathan. Can you go ahead and introduce yourself?
Hi, Dr. Granita Lathan, Interim Superintendent for HISD. Been here in the district actually 5 years, and I'm just excited about the opportunity to provide social and emotional support for our students, not only during the COVID-19, but actually prior to COVID-19.
Thank you, Dr. Lathan. Selena.
Yes, good morning, or actually good afternoon. My name is Selena Munoz. I'm the Director of Guidance and Counseling for the Isleta Independent School District in El Paso, Texas. This is my 21st year in the district, and so prior to being the Director of Guidance and Counseling in this district, I've been an elementary teacher, a school counselor, and an administrator at the elementary, middle, and high school levels. And so I just look forward to being with everybody here today.
Thank you so much, Selena. Welcome. Chad.
Hi, good afternoon, everybody. My name is Chad Castrita. I'm the founder and CEO of a mental health social mission known as Care Solace. Our whole mission is about linking students and families up to community-based resources within an hour. Our whole mission is around slicing through the barriers and the red tape that a lot of families and school counselors and students go through when they navigate or try to get linked up to care. Our mission is to slice through all that. We currently serve about 1.5 million students and 109 school systems, and I'm really delighted to be here. Thank you for the opportunity.
Thank you so much and welcome. We're going to go ahead and start with each person having the opportunity to share a little bit about what your philosophy on mental health services is and social emotional support. Dr. Lathan?
And actually, my philosophy on mental health support for students actually started when I was an alternative school principal. in the southwest suburbs of Chicago. And all of my students actually had behavior and emotional issues. And we provided supports through social work support, art therapy support, music support, counseling support. And so that love of ensuring that students had everything they needed to be successful academically, and now actually being able to see that through here in Houston is wonderful, because we have wraparound specialists in our district. We have counselors and social workers that are providing students the resources that they need. But that philosophy is ensuring that as a school district, we are able to fill in the gap with what students need socially and emotionally.
Much, Dr. Lathan. Selena, what is your philosophy?
And so social and emotional learning has always been true to my heart, even back in the classroom when I was a second grade teacher, and was part of the reason why I got into counseling. I just felt like being a teacher was something that I truly loved, but I really wanted to really serve and help and support students in another capacity. Working with the students at the school that I was at also gave me an opportunity to work with faculty and staff throughout the school to ensure that students were being supported socially and emotionally. We know that when students aren't doing well socially and emotionally, then it's very hard for them to thrive academically. And so this being my second year in this position, this has actually been our third year implementing a district-wide social and emotional learning program. And so we've had an opportunity to train district-wide administrators and counselors and teachers and instructional specialists on SEL. And our whole goal behind this training has really been to teach and equip these adults with the skills and best practices so that they know how to best support the students in this area. And so as we continue to move forward and as we continue to prepare for the new school year, we know that as a district, this is definitely going to continue to be a goal and a big focus for us.
Thank you so much, Selena. Chad.
Yeah, thank you. Well, my philosophy is a bit different than my two fellow panelists. I have, this is personal for me. I have kind of been in the battle myself personally with mental health, and so much that that I launched this mission because of this. And my philosophy is pretty simple, that families and students need to get access to not just quality and trusted, but timely community-based mental health resources. And you know, it kind of pains me to see that what they go through now and having to navigate the mental health system on their own, or not knowing where to turn or where to go. And our organization tries to make that a lot easier, and we have. And we just want people to get help when they need it, without any barriers whatsoever. We want the community resources and community partners to get involved. And so our mission has been about, and my philosophy has been about, how do we aggregate and push forward in a proactive way all of the great work that our communities do in mental health? How do we make this accessible and known in a scalable way so that every family, every student that is struggling, and every staff member that's personally struggling, how do they get timely access into mental health community-based resources? Thanks.
Thank you so much. How is mental health impacting people of color and students of color, especially with the current state of our country right now? Not only COVID-19, but Black Lives Matter. Can we elaborate on that right now, please? Whoever would like to take it first. You want to go, Dr. Lathan?
Sure. I mean, the impact is, for so long, I can speak to the African American community. We didn't seek out services. You sought services through your church affiliations, if you were a member of a church, through your pastor or your priest, but you did not seek out those specialized services or professional services. And so that stigma at times is still there in certain communities, but it's based on what's happening in our country, not only as it relates to the incidents of the past 2 weeks, but also with COVID-19, it's still a major crisis for Black and Brown communities because services are not available. And then, as Chad stated, immediate services are not available. Our families have to wait and wait for someone to call them back or wait for a referral. So it's a major challenge for Black and Brown communities, and that's why school districts are stepping up to provide the services that children and their families need.
Absolutely, Dr. Lathan. Thank you so much. And thank you so much for being everybody here, really, and those that are on the call and with us to really be here to learn, to listen about the urgency around the situation, about how our communities are being impacted, in particular, during this pandemic and during the racial context that's happening right now and has been happening for a long time. We can't let this go to the wayside. So I know we're here because we believe in this work that we do, and we're working diligently to make sure that needs are addressed as best as possible during this unprecedented time. Selena or Chad, would either of you like to weigh in on that?
In general, as a district, the others have talked about the difficulty in connecting families and students to the mental health resources that they have needed, and that is something that we have definitely seen just in our city. Some of our agencies at times, I speak from the experience that we've had, not with all agencies, but it's been difficult just in general to connect families and students to the support and resources they've needed because of not the lack of resources, but the demand of mental health services, counseling services, and therapy that have been in great need in our community. And it's been difficult at times to connect those families because of the limited amount of resources out there and the therapists that are available and able to provide the services needed for our families. I can speak, I can think of one example with one of the agencies that we work with that's in our community, and there's been times where it's been difficult when we've referred families and students and getting them to get connected to those services quickly because of the long wait list. And so I know that even more so now as we go through this pandemic and everything that else that is happening in our country, that mental health is definitely going to continue to be a priority. And so we've got to be able to connect with as many resources and outside services and agencies as possible to ensure that our families and students are receiving the supports and the services that they need, but that they get connected to them as quickly as possible so that they get the help that they need.
Yeah, and I just would add to that we have seen at CARE Solace obviously a triple the amount of phone calls that we received here at our center mostly for parents that have or kids that have struggled with their parents losing their job. We've seen financial trauma calls for kids as low as 5 years of age that are just concerned, that have reached out to us. It's been unbelievable. And now the Black Lives Matter movement, we've seen an uptick in people that are just angry and just want to talk. As someone that has experienced a lot of this in my own personal path and journey, unity is the biggest thing here. People need to talk. They need to share how they're feeling. They need community. Hence the protest. And I think when people are in a group setting where they could share with people that are experiencing what they're experiencing, it feels good. And so the more we can share in a group format, whether it's open in community or in private sessions with a licensed practitioner in group therapy sessions or with community groups, and share what is going on inside of yourself with others, people start the healing process. And I think it can't be just Mental Health Awareness Month. You know, this is something that's got to be year round. Year round, we have to establish that, you know, mental health cuts across, you know, all income levels, all races, all genders, and it's something that we have to keep on the forefront each and every month, not just during the month of May for Mental Health Month. So I think that the more they can get connected to community-based groups, the more that they share in a private manner or an open format is only going to help them feel better.
Thank you so much. Given that we're under this kind of restrictive social distancing, right? It's difficult for us to have engagement face-to-face unless we have proper PPE. I mean, some people are taking a risk, and you know, I see that as maybe potentially like a limitation to some extent. But where could we see a bright spot as far as access and reaching out to, maybe it's not so much of a limitation as one would think, as far as gaining access to some of the different services that could be that are offered?
In HISD, we launched a 24-hour hotline, mental health hotline called Let's Connect. And it's manned 24 hours a day. During the workday, it's manned by district, licensed district staff, and then after hours by a counseling agency, so that we can ensure we're connecting our students. We had issues and concerns, especially as it relates to suicide pre-COVID, and then moving into COVID, we've seen a number of issues that Chad has already mentioned with unemployment, just issues with people being indoors, having to be confined. And that was one tool that we've utilized to reach our families, to ensure that people have someone to talk to. What's interesting is we also have staff members. You know, we share information through EAP, which is our employee assistance program, but we've had staff members to also call that 24-hour hotline. So we're able to reach staff or students, and they're safe and they're healthy. That's what's making a difference, and that's what we believe in our district.
One of the things that we were able to do as a department and in our district was when we went into closure, which was around March the 23rd, we knew that we had to quickly put systems and supports in place to not only be there to support our counselors, but to ensure that they were in a position where they could turn around and be ready to support their students and families. And so part of that, I was very fortunate. We have a district counselor leadership team, which is comprised of elementary, middle, and high school counselors. And so we quickly got working. We met with the team and we started having discussions and conversations of what the role of our counselors is really going to look like in a virtual setting, because of the fact that this was the first time that we were all going to be working remotely. And so in having conversations with the team to discuss and clearly define those areas that pertain to the role of our counselors, once we met with the team, we were able to disseminate that information to district-wide counselors and administrators, but also work with the team to develop an online counseling referral form, which was developed by the team and my department. And so we were able to make that referral form available on every campus homepage so that families could request counseling services throughout this time. Campuses also shared the form through the various platforms that they were using as they were disseminating information to their families. And we were also able to make this form available on our district parent resource page. And so that referral process, that online referral process has been a great tool and has been really helpful in assisting our families in reaching out to us as a district during this time when their children and they've needed the counseling services. And so it really assisted our counselors in connecting with them and providing the support and services that they've needed during this time. We've also connected to local agencies. We developed a really close partnership with Emergence Health Network last year, And so during this time, we've really been able to connect to local agencies and share the resources that they've provided with us during this time, so that we can share these resources with our counselors to ensure that they were connecting their students and families to the support and services that they needed during this time as well.
you
From my standpoint, you know, the whole thing is how do we get these students and these families out of isolation? How do we get them to open up, kind of peel the onion, so to speak, to get them into sharing and get them into care, whatever the case may be that family or its household's dealing with. And so what we've been able to do at CareSolace is provide a anonymous link. It's a student and family link that it gives them the ability to anonymously connect to a telehealth therapist within minutes. That seems to be working, and we've seen, you know, thousands of people take advantage of that. But more importantly, there's so many technologies out there and so many things available to slice through the isolation, to get people opportunities to get them help, you know, the help that they need, that they wouldn't otherwise, you know, maybe go down that path. We feel like there are a number of student groups and families groups and parental groups that are available online. We connect families to on a day-to-day basis. We have host a lot of Zoom meetings for students and for families to be able to kind of slice through that isolation during, you know, social distancing. And then we have a lot of telehealth resources that we're able to link up parents and families with therapists. You know, if the family's in San Antonio, we might be able to find a therapist in Dallas, for instance, or even in Fort Worth, to maybe make that connection and at least get them to talk and open up and get out of isolation. So some of those technologies, some of those some of the direct links into telehealth resources seems to be working pretty well.
Wonderful. I think that I appreciate how you've taken the opportunity to talk a little bit about the opportunities that present themselves as far as coordinating and connecting the resources to students and families that have a need right now. Dr. Lathan, I would love for you to elaborate a little bit more on what HISD has been doing outside of the hotline that's been set up even before COVID, with our philosophy on educating the whole child, wraparound service supports for our students, and how it has escalated at this time and how we've really implemented it in a even more profound way.
Thank you. So number one, our board actually had a vision about 3 years ago as it relates to ensuring, and they set a goal by 2022 that every campus would have a wraparound specialist. And some of our campuses actually have more than one wraparound specialist. About $10 million has been invested into our wraparound specialist program. The wraparound specialists are responsible for connecting parents and students with resources in the community. And so they're the ones making those phone calls, helping. For example, we had a family that lost their home to a fire. So they've connected them with helping them find a relocation, finding furniture, food needs. And then as it relates to COVID, our wraparound specialists have really, they've conducted home visits, ensured that students had what they needed as it relates to technology devices or the paper-based instructional packets. And then our board also, in the beginning of COVID, had the vision around some emergency constraints. And the emergency constraints really are for me as a superintendent, saying, Madam Superintendent, here are the things that you must focus on during this time of COVID-19. So we paused our current board goals and we're focused on those emergency constraints or priorities around student safety and well-being, staff safety and well-being, academic focus, instruction for students, and then wellness. And so let me just talk about those just a little bit as it relates to those emergency constraints. Number one, we partnered initially with the Houston Food Bank to ensure that we were providing meals for the entire family, as opposed to just students. We've partnered with them to be able, for 8 weeks, we partnered with them to provide meals across our district for our families. Since the school year is over, we've now transitioned back to at 71 sites where students and families can pick up meals for 3 to 4 days at a time. Also around those emergency constraints, the board was very concerned about the social emotional learning for students. And so within those emergency constraints, I established progress measures. There are nurse wellness checks, counseling wellness check. But when we talk about counseling, we're talking about school counselors, wraparound specialists, social workers. In our district, we have a variety of positions or agencies that support us. And so we wanted to make sure we were capturing the work of all of the individuals that are supporting our students. And then we also wanted to ensure that we were educating parents. Weekly, we provided SEL a webinar that's live on Wednesdays, and it's also recorded in English and Spanish, so our parents can go back and replay it. We also created a trauma toolkit for our educators in the district so that they would have the resources that they needed to support our students during this crisis. And our school year ended last Monday, June 1st. However, these emergency constraints actually will carry us through August. And then the board will make a decision at that time if they're going to continue or if we're going to revert back to the board's goals. As it relates to staff safety and wellness, it's communications around COVID-19, communications around the employee assistance program or various programs, including where they can go to get tested for free for COVID, as it relates to COVID-19, ensuring that we have PPE for our staff members when they are asked to report to work. And so we're doing that, and we're monitoring that every board meeting, either at what we call agenda review, where we'll be reviewing the board's agenda, or at the board meeting, I provide an update on our goal as it relates to those progress measures. And then monthly, I provide the board with an instructional continuity update. But mainly, the most part, the largest content or portion of that instructional continuity update is around social and emotional learning and how we're supporting students and families during this time. I think you're on pause, Trustee Villaseca. I mean, mute. I think you're on mute.
Dr. Lee. Am I still on mute? Let me turn my camera off again.
We can hear you now.
Is that better?
Yes.
Okay, I'm going to keep that camera off. Thank you. Thank you so much, Dr. Leith. And as you can see, there have been lots of years of work in HISD around making sure that we're investing and the supports for our students, understanding that mental needs and basic needs need to be met so that they can receive and intake the academics that our students need to get while they're in our school system. And so Dr. Lathan has done an outstanding job helping to ensure that the wraparound services are expanded across the district. And the board, we did set those goals, and we were able to pivot and incorporate what was already happening to make sure that the focus and the priorities were being met right now during this this unprecedented time. So thank you so much for elaborating on that. Would Selena like to share a little bit more about what's going on in Isleta?
Yes, and so as I mentioned earlier, last year we were very fortunate to have developed a close partnership with the Emergence Health Network, which really allowed us to collaborate on our district initiative of promoting mental health. And so this entailed coordinating district-wide training on mental health and first aid for district-wide counselors, administrators, and various departments in an effort to educate everybody on the signs and symptoms of mental illness, I apologize, how to intervene, and really just how to help a child who may be experiencing a crisis in order to get them the help that they need. Not knowing that we were going to experience something like this or go through something like this, I know that this training was extremely beneficial to not only our counselors, but everybody else that has gotten trained. And we know that as we move forward and we start preparing for the new school year, this training is definitely going to continue to be beneficial for everybody as we continue to support our students and our staff. One of the other things that we did as a department was, as we went through district-wide training last year as a department, we took on the initiative of developing a mental health and mental well-being module for our district-wide counselors. And so part of that was to ensure that our counselors got trained on that component so that they were in a position to turn around and train their campus faculty and staff. And so we know that self-care definitely has to be a priority, not only when it comes to ourselves, but in helping others to take care of themselves, because we know now more than ever our students are going to need us as we've gone through this pandemic. And so part of this was ensuring that our counselors were in a position to turn around and train their faculty and staff on the importance of mental health, the importance of self-care, and just the importance of mental well-being. And so we just completed our second year in doing this. And so we definitely look forward to continuing this district-wide as we move forward into the new school year. As far as SEL training, as I previously mentioned, this is our third year implementing a district-wide social and emotional learning program. One of the things that we did actually start this year with campuses was each campus did establish a campus SEL team, and the whole purpose behind that was to definitely work with, as a department, to definitely work with those SEL teams at each campus so that they were in a position to sustain those best practices at the campus. And so as we've continued to implement SEL lessons in our SEL program moving forward, one of our biggest goals will be to continue to focus on implementing those best practices and working with each campus and each campus SEL team so that we can sustain those practices district-wide.
Thank you, Chad. I'm curious to hear what your experience has been more on the service delivery side when interacting with some partners and partner districts.
Yeah, thank you so much. What we've been able to do at Care Solace is infuse two kind of innovative approaches to what we believe are some of the key missing layers in navigating the mental health system, as in terms of linking students and families into community resources. The first thing that we've implemented at Care Solace is called a care concierge. Every single family gets their private and anonymous care concierge that's dedicated to them, that understands all of their needs in working in partnership with school counselors, school social workers, community liaisons, parent liaisons, a student liaison, or a licensed therapist at the school level, a district nurse, an AP or principal. And that care concierge job is to match up that family member and that student based on their race, based on faith, if they have a faith-based request, based on gender, based on age, and based on their insurance, or if they have nothing at all. And so the more we specialize in matching to their specific needs, what we've been able to demonstrate in our partnerships with school systems throughout the US is that people are willing, and that's what we need, the willingness. They're willing to get past stigma, a hard no, or this is my students, my daughter's this is just a phase, she'll get over it. Getting out of that mentality and actually into care is everything. And we've been able to convert that family in getting into care and enrolling into care through a care concierge approach. And that's that last mile handhold, to not wait for a family to call, but to proactively push an anonymous care concierge to every family and every school system we serve. So that's one thing we've done. The second thing is the warm handoff. The warm handoff is really vital to this piece. It's working in partnership with school systems, folks that actually have the relationship with the family, because we don't, and actually working with us in partnership to use our database of resources. And we have over 93,000 vetted resources that are updated monthly in our system, so that parents and students can get linked into community resources, whether they have insurance or they don't have insurance. And so the warm handoff allows us to be able to work with that school counselor to warm hand it off to us, contact that parent, introduce them to a care concierge, and to be able to match them up by the criteria I just outlined. And the warm handoff seems to work really, really well with our partners, because it takes that heavy, it's a lot of work to follow up with families and actually find accessibility for families. It takes phone calls after phone call after phone call. And many times existing MOUs in school systems have a wait time a 1 week wait time or a 2 week wait time where the parent has to sit there waiting for a call back to see somebody. So in the warm handoff, we're able to come in there, ascertain be introduced to that relationship, ascertain the situation, match them up by the criteria we mentioned, and to be able to find that family through a concierge and through the warm handoff, find them access within the hour. And so those are the two elements from a service standpoint that we've been able to successfully implement at our school district partners.
Wonderful. It sounds like you've been able to identify some gaps and really put your mission to work in making sure that students and families are able to receive the care that's needed right now. So what should board members and administrators not lose sight of as we navigate the pandemic and these times?
Number one, I want to just say to Chad and Selena, some of your strategies that you've shared today, if you look up and see some of them being utilized in HISD, I want to thank you in advance for sharing. What superintendents and board members should realize or think about is there are brighter days ahead, that we are going to get beyond what's happening as it relates to COVID-19, student achievement, and ensuring that every child in all of our school districts and across the great state of Texas, that they receive a quality education, and that we focus on the whole child. And we do that as a team, not only a team focused on just our school district, but focused on every child in this state. And so there are better days ahead. And I know that, and I believe that despite all the things that are going on in our country right now, there are better days ahead for the children that we serve.
We know now more than ever.
Thank you for that.
I'm sorry. I just wanted to share that we know that now more than ever, it's going to be critical to support students' social and emotional needs, along with any mental and behavioral needs as we prepare for the new school year. Academic learning, I can tell you, is going to be extremely difficult if our approach and our practices don't identify and address the social and emotional needs of our students, along with the needs of our staff as well. We also know that the only way we're going to be able to get through this, there are brighter days ahead. We know it's been a challenging time, but we know that the only way that we're going to be able to get through this is if we do this together. There's no way that one individual can definitely do this alone, especially with the mental health demands that this pandemic has created. And so it's going to definitely take everybody at a district level and campus level to be able to address the needs of our students and our staff. And so first and foremost, reestablishing a sense of safety and connectedness with everyone is definitely going to be key this coming school year. And when I say this, this means that we've really got to take the time to focus on and connect with and support the adults that directly work with our students if we're going to expect them to do the same for our kids. Time is definitely going to have to be given to listen and learn from what we all have experienced going through this, so that we know how to best support one another, but also ensuring that our adults know how to recognize and understand and regulate their emotions so that they're able to provide a safe and supportive and nurturing environment for our students. We can't expect the adults to teach and model SEL skills if they don't have these skills themselves. And so I know I talked about self-care a little while ago, but the other thing is we're really going to have to make self-care a priority while really helping others to do the same, because we know that our staff and our students are going to need us now more than ever. And so it's going to be very hard for us to take care of others in our district if we're not taking care of ourselves. So this is definitely going to have to become part of every campus culture.
Absolutely, Selena. It's really, really important to make that space for personal self-care, to model it, to create it in this. I think I know from on the HISD side that a lot of our educators and school leaders have enabled space and have prioritized space to be able to talk about that as a team. And I know that's something that Chad was talking about earlier on the conversation, the opportunity to create that space, to create community, to norm what's going on to some extent, and to know that there are those supports can help anybody get through the day, right? You just don't know who you're touching, who might be sitting in that circle. I know that that's something that some of our schools implement as well with our students, right? So the circle practice, it really, you just don't know. And then we have the systems on the back end and the teachers that are on the front lines that are able to identify some of those needs. And then we have the wraparound service specialists and HISD to be able to connect those needs to the students and families that need them in the community. So it's really like a whole wraparound, that's what we call wraparound service specialists, effect that's going on to really wrap around and uplift our students. Chad.
Yeah, thank you. Really great stuff. This is a lot of fun to be a part of. There's going to be an increased demand. There's no question about it. And the demand, unfortunately, is on school systems. They're front and center. Demand of students' needs, parents' needs, staff needs, and really the missing piece of their staff. I think that, I just was doing some research on this, but in grades 9 to 12 in the state of Texas, last year, 544,000 students reported sadness and hopelessness consistently every day for a 2-week period. I really feel that that's going to increase when school comes back, or whether it's a hybrid approach or whatever ends up happening. But I think not just students are facing this, but with everything that's going on, families, there's going to be an uptick in families and staff. So how do we take the pressure off you all on the front lines? That's what we're trying to solve at CareSolace. How do we make it easier and less of a burden to have to navigate the mental health system and navigate groups and availability and access for all of these pressure points for people? So we are working hard to solve those problems. We're scratching the surface. We made a big impact, but we really feel like the demand is going to hit hard. And so we're preparing for that here at CareSolace. And we're ready. We're fully operational. We hope that staff are open themselves up to resources. We know that the traditional ways will not be sufficient. We know that we have to find innovative solutions, new ways to bring people out of isolation, to get people talking, to exposing themselves, and there's a lot of ways to do that. So I really feel like, to answer your question, that it's only going to increase, and hopefully there'll be a tapering off towards the end of the year. But when school comes back, the demand will be greater than ever on school staff and parents and students.
Point well taken, Chad. I think that, and I can speak from a trustee's perspective too. I know Dr. Lathan mentioned that some of the emergency constraints and priorities that we adopted are set to expire, but I would venture to say that a lot of these are going to be embedded into what we're already doing. And I know that we'll have that conversation with a team of 10 here sooner rather than later, but doubling down on these supports and making sure that our kids, when we do have this, they come back to school, or the reentry, however it's going to look, that we continue to provide the supports and the extended learning and just to really be prepared, and that we're focused. And so our superintendents know that it is a priority, that we actually have it as an official priority as well, and that we're able to align our resources to make sure that our students are going to be able to get the supports that they need to be able to heal and to be able to be ready to continue in their learning journey and their evolution as humans. And it's going to be really important. So I know that this is, we've been talking about how we've addressed these so far, and how HISD has been doing it for several years now, and then the continuation of it's going to be ever so more important. So before we turn it over to our Q&A portion of the panel, I do want to ask, we talked a little bit about self-care too, but what should trustees and superintendents do for self-care? I'm smiling with you, Dr. Lathan, and you can't see me.
That's a good one. We use humor a lot. Our team of 10, we of course have rules and priorities, and sometimes we kind of pick at each other if someone's violating that rule. But I think as it relates to self-care is, like I said, for me and our group is focusing on those emergency constraints. And the way we take care of ourselves is ensuring that number one, we take care of ourselves personally, we take care of our families, as it's important that all of us remain well, all of us remain safe, so that we can help our staff. One of the ways, and I really want to brag on some of our principals, at least two of our principals, is I have one principal that's the principal of over 3,000, and she did a wellness check on her students. And so I'm giving a strategy or secret away that every day there was a SEL question of the day, and that was how they checked on their students to make sure that they were well, but also how they took attendance. And so those high school students daily had to answer that question. I have another principal that did self-care with her staff by they had to select the color of the heart of how they were feeling daily when they checked in. But what's humorous about that is she sent it to me one day. She says, okay, you're always checking on everyone else. Today I'm checking on you. Heart me back the color of how you're feeling. So I had to send her a heart, a text that says, I don't know how to select the heart or to put the heart. I can tell you what my color should be. And I say that with humor because at times we don't check on each other. And I think it's important that trustees and superintendents take a step back and focus. I know for us, we are ready to pass a budget this week, and it's been a lot of stress around that because we want to do so much to support our staff, but we must first take care of ourselves. So self-care is taking care of yourself and putting yourself first. And that's hard for us to do.
Yes, indeed. It really is. It really is hard to because we're on the front lines of providing and making sure that other needs are met. Others' needs are met first, right? And that's just that's our go-to. It's our MO in education, right? And so it's easy to forget that us being on the front lines, if you will, it's to check on ourselves or to allow us the time to reflect and to heal and to process and to get additional care that we need is important, right? Because sometimes it's just go, 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 and what can we do to help others and without really checking in on ourselves. So thank you, Dr. Lathan. Selena and Chad.
And it's so true. We're real good about preaching it, right? But when it comes to practicing it, that's where we all struggle. And but however, we know that it's definitely important. One of the things that was so true with our counselors as we were going through this challenging time when we went into closure was we had counselors at home. You know, this was our first time working remotely, but we had several counselors, of course, that have families at home. And so it was clearly evident that they were struggling trying to balance their work and their personal life, you know, trying to work from home, but trying to be that husband or wife and then attending to their children and trying to be that teacher for their child at home. And so we knew that it was definitely difficult for them. I think one of the most important things that we did right from the get-go when I talked about putting systems and supports in place for our counselors, we knew that we had to do that because we knew that they also had to be in a position to be ready to turn around and support their students and families and faculty and staff. But we implemented a check-in tool, and it was just something that we developed as a department, and it really the purpose behind that was really just to check in with our counselors throughout this time to see how they were doing. It went out every Friday. We had developed some questions, and it went out on every Friday, and we were able to really just gather information related to how the week went for each counselor, the types of supports and students services that they had been providing to students and families throughout the week. How they were staying connected. You know, we talk about connectedness and the importance of relationships so much. And so we wanted to know how during this time they were not only staying connected to us, of course, as a department, but how they were continuing to stay connected with their colleagues, because we knew that was important, and their faculty and staff. And then just really letting us know what additional training and support, any kind of support that they needed during this time. And so as a team, we were able to come together and review the information as we went from week to week, and it really helped us to identify any additional supports and resources that we needed to continue providing them during this time. We also knew that it was important to provide ongoing support meetings by level for all our counselors. And so it really gave us an opportunity to accomplish several things, not only to stay connected with them during this time, but to share relevant and important information to ensure that we were all on the same page, because this was so new to all of us, but just really gave us an opportunity to be present and to be there for them, so that we were able to listen to any concerns that they had, and to answer any questions that they had as we were going through this together.
Thank you so much. Chad, if you can take just 20 seconds to go ahead and wrap up so we can afford our listeners the opportunity to chime in with some questions.
Yeah, I was part of a superintendent's group the other day, and they focus on three things. Number one is superintendents are just taking a walk, just literally just taking a short little walk and just going outside and being present. That's one thing we heard. The second thing was having staff pause for multiple 5-minute increments throughout the day and pause and breathe, whether it's meditation, whatever it is you want to do, but just pause and breathe. And the other last piece of this is for self-care, as teachers were distributing these little faces that they can do through an app, and they can disseminate these faces to students, so students can check in on how they're feeling prior to the engagement, whether it's a happy face, an angry face, or whatever it is, a sad face. Then they can roll that up and have one-on-ones with those students. Thanks.
Thank you so much. Right now, we're going to have the last 8 minutes or so for the crowd to have the opportunity to enter in the chat box if you have a question. And I think there's also an opportunity for you to raise your hand. And so we will randomly select some people that have participated today on the webinar to ask questions of our panelists. Jamie or Cinto, do you see any questions coming through yet?
We have one question from Dr. Stan Paz. Our youth are rising to the call of justice during these days. How might we channel their enthusiasm at the beginning of the year and throughout the year?
Who would like to take that question? And for the Q&A, we'll just have one person respond, so we have the opportunity for others to ask questions.
One way is to allow students that platform throughout the school year, especially when school starts back, hopefully some level of face-to-face engagement, or even virtually allowing students to hold meetings and to engage their peers, also to engage staff members so that they understand where students are coming from, but providing them a platform either virtually or face-to-face so that the conversation can continue beyond just a month or two.
All righty, thank you so much for sharing, Dr. Lathan. Are there any other questions from our audience around mental health and social emotional supports? It looks like Sylvester has a question. Sylvester, would you like to ask your question if you can unmute yourself?
Yes.
Or type it in the chat. Okay, there we go. We hear you.
Yes.
Yes,
Okay.
Sylvester.
You know, as a board member, sometimes one of our main priorities is policy. And is there a suggestion for a need in policy changes, and how can we help our staff in pointing them in a new, quote unquote, direction with new needs coming up? such as coming. I got muted. I'm not sure how that happened. Can you hear me again? You know, I'm looking, you know, we're going to have new needs. So is there a need for a new direction for, as a board member, giving to our staff?
Were we able to hear Sylvester's question? It sounds like he wants to know how, I believe it sounds like he wants to know how he can work with his board to create an opportunity to talk about the importance of these needs and possibly put some policies into action.
I think that's going to entail bringing the right people, not only from at the district level, but at the campus level too, to be able to come together and to discuss the needs that we're going to see throughout the district, and to get everybody's feedback and input in regards to what needs to be done to ensure that we are definitely addressing the needs of all of our students, but also addressing the needs of our staff as well as we move forward and begin to prepare for the new school year. It's challenging. We don't know. Of course, there's brighter days ahead, like we shared earlier, but we don't know what that's going to look like right now. I know decisions are still being made on whether we go into a hybrid model where some of it is possibly face-to-face and some of it's virtual, but I think regardless of what that looks like, we need to be able to come together and to have those conversations and to listen to everybody and get feedback and input from everyone in regards to the needs that we have as a district and what those supports and services are going to look like, not only from a district standpoint, but also making sure that we're connecting and working with our local agencies to ensure that we have those services and supports available, so that when we do have to reach out to them, that we're able to connect those families that we have identified to ensure that they get the help that they need.
Thank you so much, Selena. Colleagues, Cinto, Jamie, are there any other questions that are coming through? Anybody that has their hand raised?
I don't see any, and I know that we're at 12:58. We good, Holly?
Yes. So why don't we go ahead and hand it over to, before I hand it over to Ty Jones, who's going to be from Lancaster ISD, who's going to be closing it out for us, I do want to say thank you. Thank you so much for your dedication in this mission-driven work, making sure that our students are getting what they need, the families are getting what they need, so they'll be able to be able to cope, to be able to make it through these really trying times. We know that this is going to be extended. Trauma often comes back 6 months later down the road. We need to be prepared for reentry. And I know that we just can't thank you enough for really taking this work to heart to make sure that this is part of our day-to-day and meeting our students' need as part of their experience in schools. And so thank you to Dr. Latham, thank you to Chad, thank you to Selena for calling in, for being part of this panel today. We can't thank you enough for your time and for your work on the ground with our students and families so that they can get their mental health needs met. Ty, go ahead.
Right. Good evening and good afternoon. Thank each of you for your participation today. We truly appreciate it. Your words rang great for me. So I'm going to be reaching out to my board and to our superintendent about. I do want to affirm a lot of you guys from what you're doing as it relates to the hotline, the telehealth, and just taking care of yourselves. That's the most important part as educators, that we must be available. And in order for us to be available, you guys have to be there, healthy, and in your right state of mind. So I think the taking a walk is one of the things I'm going to do myself. I'm walking around the house crazily now, ready to get out. But definitely appreciate you guys for your words. Self-care. Keep doing what you're doing. And if we can benefit you and afford you any kind of opportunity to speak even more, we're here for you. So again, thank you very much.
Thank you so much.